Good afternoon and welcome once again to our weekly COVID-19 public health update with Montgomery County Executive Marc Elrich. I'm Lorna Virgili, Hispanic Public Information Officer for Montgomery County government. And also joining the county executive today is Dr. Earl Strader, who is the Acting Assistant Chief Administrative Officer, as well as Dr. Travis Gales, who is our health officer. Reporters, you should all have permission to record. If you do not, please use the chat to request it. And with that, Mr. County Executive.
So good afternoon and thank everybody for joining us on our weekly press briefing. First, I want to make a quick wish of Shana Tova, Happy New Year to our residents who observe Rosh Hashanah. And I do dearly hope that we all get a peaceful and better new year as we move forward. This week, we will mark the 20th anniversary of the September 11th, 2001 terrorist attacks. And on Friday morning, Montgomery County will host an event at our 9/11 Memory Garden here in Rockville to honor the 11 county residents who perished that day. This week will be a day of reflection for their families and our county, as this Friday we will pay honor to those who lost their lives that day. 9/11 changed our country in so many ways, including our re-entry into Afghanistan. And now after 20 years, we've ended our military engagement there. It's been noted that the war in Afghanistan lasted through 4 presidencies over the last 2 decades. But in reality, the Afghanis have been in conflict a lot longer than that. Jimmy Carter was the first U.S. president to engage the United States in Afghanistan, and turmoil in this country has occurred over 40 years and 8 U.S. presidents. Now we must help repair what we broke and take care of the refugees that have recently fled to our shores and arrived in our country. I wanted to mention that Councilmember Evan Glass, who works on refugees issue, has organized a rally for Afghan refugees tomorrow at 7 p.m. at the Silver Spring Civic Building. And I want everybody to know that the county is participating, working with the state and federal government in the resettlement of refugees that will be coming to the county. I want to thank Evan for his efforts on this issue and encourage our residents to attend this rally. As for our COVID update, today our test positivity rate is 3.33%, and we have a case rate of 15.28 per 100,000. We had 149 new cases yesterday, 7 hospitalizations and 2 deaths. Just a reminder, 2 months ago, we were in single digits. Last week, I mentioned that our 7-day community transmission rate had gone from substantial to high according to the CDC, but we're right back on that line. We've bounced back and forth between the substantial category and the high category. As you can see from the map we're showing, we are one of the few jurisdictions in the entire Mid-Atlantic that is not in the high transmission category. And there's a second map that shows, focuses on Maryland, and you can see the orange counties, which are considered substantial. And the bulk of the state, as you can see, is in the red or high category of transmission. Our vaccine rates, we continue to have the highest vaccination rate for all jurisdictions with more than 300,000 people. 74% of our total population is fully vaccinated. That's about 0.6 percentage points higher than last week. And 87% of the eligible population is fully vaccinated. Again, 0.6% higher than last week. If you look at the data overall, it's about 81% with 1 dose, 74% fully vaccinated, 96% of the population over 12 with 1 dose, 87% fully vaccinated. Roughly the same numbers for people over the age of 18, and for the population over 65, 99.9% with 1 dose and 94.9% fully vaccinated. Our week-to-week growth in vaccinations obviously has slowed despite our high numbers, and we still need to be figuring out ways to engage and continue to vaccinate more of our residents. Last week, I mentioned my desire to mandate that all restaurants, theaters, gyms, and entertainment venues require vaccination passports or proof of negative testing. Dealing with logistics, feasibility, and language of this policy isn't easy, but we're getting close to presenting a proposal to the Board of Health. We have to expect to see a surge this winter, just like we did last winter in transmission, and we need to do something because no one wants to go back to capacity limits and restrictions on businesses. And that is what's driving the desire to look at the passport system. We want to make sure that the residents who've been vaccinated can go out and enjoy the things we told them they'd be able to enjoy when they got vaccinated. And we want to make sure that people who aren't vaccinated don't have the opportunity to spread COVID beyond well, let's just say we don't want them to have the opportunity to spread COVID. This is not fair, especially to those who've been vaccinated. And we have come too far to regress back to where we were. And I know the residents of this county do not want to go backwards on this. Related to MCPS and COVID concerns, for over the past month, you've heard me emphasizing vaccinations as well as talk about implementing our indoor mask mandates specifically to prepare for the start of the school year. You know, part of bringing down the numbers in the community are very relevant to how successful we're going to be in the schools. There have been some issues and concerns that have come back with the return to school after almost 18 months. We can answer some questions, but I want to clarify up front that while there may need to be some changes, the decision on how and when to quarantine were made out of an abundance of caution. We have to remember that this year's reopening had unprecedented challenges, and we must be patient. I feel for the school system, which is dealing with a shortage of bus drivers, a shortage of school teachers, trying to manage socially distant or physically distant lunches and classrooms, all that while going back to teaching again. So they face, you know, real challenges, and it's not easy when you have a school system of 160,000 people to put all this back, or 160,000 students, closer to 185,000 people to put all this back together again. But they're getting it done. And let me be clear, MCPS had a plan, they communicated the plan, and they were following state guidance. And what last week shows is that the plan needs to be addressed in some respects. And this is not only an issue in Montgomery County, but in other school systems across the state that opened last week. And for the schools that opened this week, such as Prince George's County and Anne Arundel, they're likely to see the same kind of issues that we had. I started working on this with the school system last week. And over the holiday weekend with MCPS, Dr. Gales, Dr. Stoddard, and our Office of Procurement defined and purchased rapid tests in quantity for MCPS. I've had several very useful discussions with Dr. McKnight, the acting superintendent at MCPS. And by giving schools rapid tests, they'll be able to determine quickly whether a student has COVID or just the sniffles. And that's one of the things we need more certainty about. The school system, what they put forward as their plan originally was to do pool testing. I think one of the things that has happened over the last week is it's shown the limits of doing pool testing when you have to make decisions about students who show up in the health room, which may or may not ever get caught in a pool test, since the pool test is a small sample of the total population of the school. We are working to help the school get ready as quickly as possible to make sure we create a robust testing program to go beyond the pooled test program to make sure that schools are safe, and we await approval for vaccines for kids under 12. That's going to be a big and significant change when that comes to pass. The state does have some rapid tests available, but they require that the school have an opt-in program for testing, which means that a child with symptoms in the health room cannot be tested unless a parent has consented to testing. It also means that child cannot be part of the pool testing that the school system wants to do. So obviously this limits the number of people who you're going to get tested. And while it's one level of problem when you're talking about pool testing, it's a bigger problem when it comes to a child presenting themselves in the health room with symptoms that may or may not be COVID. And if a parent hasn't given consent to be tested, we will have to make decisions based on symptoms and not have the benefit of rapid tests, which would, I think, help clarify the decisions that need to be made, both for that student and for people around that student.
I can't.
The state I'd lost my place. An opt-out program would be faster and likely include more students, but we need the state to work with us on changing the requirements under the opt-in system. Every child needs a form, as I said, from the parents. The state will not provide us with the testing unless we're in an opt-in system. I do think we need to raise that. The results of these rapid tests will help us make quicker decisions, and I plan on raising these concerns with the state this week, because I do think we need to make sure that we're making the best informed decisions that we can possibly make, and that involves more access to testing and more rapid testing of people when they're presenting with symptoms. It's for the benefit of those children, it's a benefit of their families, and it's a benefit for all the other students who are in classrooms and all the teachers and staff that are in these buildings. On another note, this week, the federal COVID unemployment benefits expired for more than 7 million Americans. That is going to represent a serious drop in incomes. And if people are unable to find work, there's going to be a lot less spending in the local economies. And this has always been one of our concerns, is that the reopening of business has been slow. And I can tell you from my own personal experiences, places that I have gone to are opening later and closing earlier, which means they're employing fewer people. And if people cannot get back to work and these unemployment benefits are cut, we're going to have more problems with people not being able to pay rent. And frankly, more problems with people not having spending money in the communities, which ultimately goes to support local businesses. So I don't think the ending of unemployment benefits was the best decision that was made, and hopefully at some point there will be a change. There were 4 types of unemployment benefits that ended. The federal pandemic unemployment compensation. This is the $300 a week supplemental employment benefits. The pandemic emergency unemployment compensation. These unemployment benefits provided financial relief to those who'd already exhausted their state's unemployment benefits. And the mixed earners unemployment compensation. This unemployment benefits provided $100 a week for those who worked as both an independent contractor and an employee. And the 4th program was pandemic unemployment assistance. These employment benefits expanded eligibility criteria to include self-employed individuals and freelancers. And we know there's been less demand, for example, for Uber and Lyft drivers. And these are folks who have had significant hits on their incomes and fall under this special category that normally wasn't included under unemployment. They will no longer be eligible for unemployment, even if they're not working. These benefits ended when other COVID relief is expiring as well is wrong. You know, we have this issue with both rental assistance, which we're still getting out, but also with the loss of our eviction protection. So we're concerned about what's going to happen to the most vulnerable in the community. I'm proud of the assistance we've provided our residents in Montgomery County, such as the Working Families Income Supplement and our distribution of rental relief and things we did like that before we ever got the federal monies. We're going to continue to work hard to support every Montgomery County family who needs help. Montgomery County's latest unemployment rate is 5.7% in July, which is nearly double what the pre-pandemic levels were in 2019 when unemployment was 2.9%. On one final note, I want to talk about an issue in front of the planning board. I served on the council when the council put in a revised plan for the area that includes 10 Mile Creek up by Clarksburg. It's an extremely important and environmentally sensitive watershed, and the Pulte project there that they're trying to get approved by the planning board is called Creekside Planning Branch at Cabin Branch. Many residents, and I mean many residents, along with the Sierra Club, are urging the planning board to reject this development, which disregards the extraordinary protections put in place by the county council for the stream system because it concentrates development entirely on the 2 most sensitive watersheds. This water feeds into the Little Seneca Reservoir. It's the closest backup emergency drinking water supply for the 4.3 million people in the DC area. And then there's just a flat out environmental concern about destroying yet another sensitive stream in Montgomery County. As a council member, I was actively engaged in the years-long review by environmental experts, including those from the planning department, that led to the adoption of the limited amendment and the Clarksburg West Environmental Overlay Zone. The council and the experts were explicit about the extraordinary protection warranted for sub-watersheds in this project. And what the project is doing is in direct contradiction of the extensive body of scientific evidence indicating that the limitation of impervious cover is key to preserving water quality. I will say that, the planning board appears to have landed on this absurd notion that you can use the average, and that if you attain a certain average, that covers the stream quality. What they failed to see is that the two tributaries that will be destroyed by this plan are going to, when they no longer provide the clean water that they provide to the rest of their stream system, they undermine the health of the entire stream. That stream is somewhat mitigated by having two tributaries that have very low levels of imperviousness around them. And by going to this high average for the whole area and then putting above average imperviousness right next to the stream is a recipe for disaster. It's irresponsible. It defeats what the council clearly set out to do. It defeats the lawsuit which the county government won against Pulte, or succeeded in defending against Pulte. And the planning board and chair seem intent on undermining our water quality preservation efforts. There's absolutely no need to have this destructive development. And what park and planning gets out of this is another park. And as opposed to putting the development and spreading it over what would be their parkland, they're preferring to destroy the stream. And that's just not a responsible thing to do. Last but not least, and certainly not least, this is Dr. Gale's last media briefing. Finally, this is tough. I just want to thank him one last time for his courage, honesty, and commitment to protect the health and welfare of Montgomery County residents, employees, and visitors. I want to assure him that the person I put in his place will be required to do no less than what he did. He is the gold standard for what a health officer ought to be. He has helped lead this county to some of the best numbers in this country. And that was the kind of health officer we wanted and we had. And it's going to be the kind of health officer we're going to look to replace Dr. Gales with, because he's shown what that kind of leadership provides and what we were able to do in following the science. I just want to thank him again. Your advice, your consultation, and your compassion in doing your job during this crisis was frankly probably better than anyone in this country. So thank you so much. And now I'm going to turn it over to Dr. Gales and Dr. Stoddard for their updates.
Good afternoon and happy Wednesday. Before we get into updates, thank you, County Executive Elrich, for your kind words and working together during this past 4 years and certainly through the pandemic. Let me just be very clear and say it has been the honor and privilege of my career to serve the residents of Montgomery County. I recognize that the guidance we have put forward to our elected officials has not always been popular with everyone, but know that it has been motivated by a desire to keep our residents safe. And as we continue to move forward, I would say I do not consider myself to be the top in the country. I have fantastic colleagues across the state of Maryland, DC, and Northern Virginia, who I owe a tremendous debt of gratitude for being a great source of wisdom, guidance, mentorship, friendship, and support. And I'm confident that the state of Maryland, Northern Virginia, and DC are in fantastic hands to move forward. And in addition, Montgomery County is in fantastic hands. Dr. Bridgers will be serving as our acting health officer, and he is a tremendous wealth of expertise, experience, knowledge, practical experience, as well as compassion. And I just want to also say a huge thank you to all of the staff who have worked very hard throughout the pandemic to get us where we are today and as we continue to move forward. They have had a thankless job in many situations, because what folks don't recognize and realize is when, it's great to have discourse about how to improve things and how to move things forward, because we're learning on the fly. We've never lived through this before, and everyone is doing their level best to make sure that we have the most up-to-date guidance and policies in place, again, to keep us safe. Just understand that when you send in comments that are strong in your direction in terms of how you feel, know that we're getting as many, if not more, on the other side of the spectrum in terms of those feelings. And it is our job to balance those, that input, and again, do what we feel is best, guided by data and facts to make sure our residents are safe. And so for the folks behind the scenes who don't make it to the press briefings, who don't get to make it in the news segments and things like that, a huge thank you for all of the work that you have done and you continue to do. It has been an honor to work with you and to stand by your side as we move forward. Now, to pivot quickly in terms of, I know in terms of time, we're a little short here, but to pivot in terms of some of the areas related to our COVID response moving forward. As the county executive mentioned, our numbers have vacillated back and forth over the substantial and high line. Currently, as of this morning, our case rate, I believe, was over 11, which puts us back into the substantial range, and our test positivity is just shy of 3%. And again, fortunately, we are not seeing a comparable uptick or a significant burden in terms of hospitalizations. But we certainly do continue to keep a close eye out for those populations within our community who are not vaccinated. In particular, our children who are not eligible to be vaccinated just yet. Now, we've continued to provide third doses for individuals who are fit the immunocompromised category. I don't have the exact number, but we have provided well over 300 doses to individuals within the community at our county sites. And again, we hope that others are getting those third shots through their private providers or their specialty providers who manage their respective conditions. Now, one of the hot button issues that we saw a lot about in the news this weekend was the question of how we provide contact tracing and advice to schools. Well, we received a lot of input from a lot of folks saying, well, you can't just look at one symptom, or everything that coughs or sniffles is not COVID. We agree, which is why we've continued to follow the process we've done for contact tracing for schools from last year. And that is looking at the bigger picture and providing an assessment of individual cases for individuals who do demonstrate symptoms and getting a bigger picture before those decisions are made. I want to share something with you, and if I'm successful in sharing my screen, again, technology is not always my friend. Sorry. That's not what I wanted to do here. Okay, not successful. Give me 1 second. Stop share. Let's go back. Share. Okay, are we looking at school guidance here? Okay, so the document that we have been following is the document and guidance that we've received from the state. So here is a copy of the most recent up-to-date guidelines from August 13th provided to us by MSD and MDH. And here's the cover page. I want to shift to you can feel free to take a look at the document. It is available online, but to go to the appendix, which includes decision aids for children, for exclusion criteria and quarantining and isolation for children in child care, schools, and camps. I want to bring attention to the top of this page. This says, for the purposes of this decision aid, COVID-19 symptoms are any one of the following: fever, sore throat, cough, difficulty breathing, diarrhea, vomiting, new onset of severe headache, or new loss of taste and smell. And the decision tree and decision aid gives you different categories within which you can look at. For example, this one looks at for people with symptoms who are not fully vaccinated. And the next page looks at for recommendations for persons with symptoms who are fully vaccinated, as well as recommendations for close contacts of the person with symptoms. Now, we follow the guidelines that have been put forward by the state, as you can see through these different categories. And if you go through and read it more closely, there is one area where we do deviate from the guidance from the state. And we have discussed this with the state in prior conversations, and they are aware of our efforts here. It's this category of if a person has symptoms, with no negative test results for COVID-19 and no specific alternative diagnosis, what happens for their quarantine? So I want to highlight one quick thing. It's important to this key of no specific alternative diagnosis. So when our staff encounters this kid with symptoms, again, as listed at the top of this page, they do an assessment to find out if there are any other specific things, diagnoses that can explain those symptoms, to reduce the index of suspicion and concern that those symptoms may actually be a COVID case. That includes any relevant medical history from that student, any known or questionable exposures for that student, and they do an investigation to get a full picture. Not everyone, and particularly the general public, is able to access that information and know all the nuances behind those investigations. So we have to be very careful when we put news stories out in the news in terms of the level of detail of how we report it in terms of absolutes. And so the one area where we do differ is in terms of what do we do for contacts in those situations. So the approach that we have provided in terms of guidance to MCPS is that individuals who are close contacts of cases that are symptomatic and concerning for COVID, we have asked that they quarantine until that index case of suspicion receives a test result. Now, last week, approximately 790 students were put into the quarantine pending results category. Now, that means that those individuals were identified as close contacts of a student who developed or demonstrated symptoms concerning for COVID. Now, of that 798 folks, from my understanding, 199 students, after getting a positive result from the pool of students who were sent home, were continued in their quarantine. So we're looking at approximately 25% of those students who were asked to quarantine during that time period while we waited for results for that student who had symptoms, actually were in fact confirmed to be close contacts of a positive case and were asked to continue through their quarantine status. And so that emphasizes, again, it's not 100% of those students, but that's 25% of that population who actually had to continue. And I just want to make sure that number gets reported, because we saw a lot, thousands of kids are being asked to quarantine off of just arbitrary symptoms, and that's just not accurate. Also, overall, based upon the estimates from the numbers we received from MCPS, and I want to make clear those students who were cleared for quarantine, who were found out to the symptomatic case that they were close contact to, that the results showed negative, they were released from quarantine. They were not required to complete a full quarantine period after that result was received. Now, according to our numbers from our colleagues at MCPS, 800 some odd students were in fact identified as true close contacts to individuals who tested positive and were requested to quarantine. Now, with that said, we recognize that there could be some variability in terms of how those policies are applied. And in the last week, we have worked with our school health staff and disease control staff to ensure that folks are doing the due diligence in terms of completing the investigations to find out more and find out if there are alternative diagnoses that can explain those symptoms, and getting a fuller picture before that further advice is given. Again, this is consistent with what we have done throughout the pandemic and what other school districts are doing also. The slight twist, though, is, again, the quarantine period, which we are, to what the county executive mentioned, are working to gain access to rapid tests that will allow for students to get tested in the health room so that we can know their test status quickly as possible, so that can inform, again, the decision and need for any other individuals to quarantine as a result of exposure. The second piece that we have been working on, and we have been working on this in partnership with our colleagues at MCPS, is around identifying close contacts and making sure that the information we receive as the health department from the school staff appropriately and adequately reflects those individuals who truly meet the criteria for close contact by CDC. And so we are working to tighten that up to, again, make sure that the students who are requested to quarantine are truly, in fact, meeting that criteria. So In summary, I just want to throw that out there and address a lot of the concerns that have been expressed by parents and others within the community, that we again agree that not every symptom is COVID, and we're doing our due diligence to separate those symptoms that are most concerning versus those that can be explained by something else. And obviously this will take on added significance as we continue to move forward into flu and cold season, being able to differentiate those symptoms. But certainly one of the other tools that will help with that will be access to rapid tests to be able to know those diagnoses quickly. And just one last thing to put into perspective numbers. We're talking 163,000, close to 163,000 students who returned to MCPS last week. School health staff noted approximately 125 students who were sent home with symptoms concerning for COVID. Do the math, that's an extremely small percentage. And then when you talk about the students who were asked to quarantine for a short period of time, again, we do not dismiss the value of in-person education. Don't get me wrong, we're not dismissing that, but that number is less than 1%. And so 99.3% of the students who attended MCPS last week were able to do so successfully in the setting of significant events happening in the world and being in a pandemic. And we hope that that number continues, and we will continue to work with our colleagues at MCPS as well as our non-public schools to ensure that our students are safe and we minimize the disruptions as much as possible. So I will conclude there, but again, thank you to the parents who have, and others who are concerned in the community who have sent in their feedback. Again, this is a process that is evolving, and I know that the staff at MCPS as well as our non-public school leadership are continuing to meet daily, seek advice and guidance, and to come up with strategies, again, that maximize student and staff safety and minimize the number of disruptions that students may face. Thank you.
Thank you, Dr. Gales. Dr. Stoddard.
I just have a couple comments, and we'll keep mine brief so that we can get to questions. First off, I just wanted to note that there are conversations going on between the jurisdictions across the state so that we can learn from what others are doing in the school space, but also so they can learn from what we're experiencing. Obviously, the best laid plans work until they're implemented, and then they have to be iterated off of, as Dr. Gale said. I think everyone across the state, those who have opened, I know Frederick County's had plenty of issues in their school system so far, and others are opening this week, and they're about to find out how challenging some of these things can be. And so we're very much interested in sharing our experiences and learning from theirs, how we can proceed and make this a more effective strategy moving forward. The only other thing I want to note is we are continuing to collect data on our employee vaccination rates. So far, we've heard from roughly 40% of our employees, and we have until next week, end of next week, for them to provide information on their vaccine status. So far, we're sitting at 96.4% who are fully vaccinated amongst the 40% who have reported so far. And so we're cautiously optimistic that we'll have a very high vaccination rate. We expect that. But obviously, we'll be looking for the data that comes in between now and through the end of next week to confirm that. And then from there, we'll take next steps to discuss with our employees how exactly we're going to proceed with this, this mandatory testing process that we'd like to implement thereafter. But obviously, we're hoping that we'll have a very low number of people who have to participate in that mandatory vaccination or mandatory testing, because the vaccination rates will be quite high. So I will stop there, and we're happy to take questions.
Thank you, Dr. Stoddard. First question, Tom Fitzgerald, Fox 5 DC. Good afternoon, Tom.
Good afternoon. Thanks for doing the call as always, and congratulations to Dr. Gales for not having to deal with the likes of us for the foreseeable future. I wanted to start just quickly. I'll give you both questions back to back. County Executive, you referenced what's going on with the schools right now, and that the county is working with them to get these rapid tests in. What we're hearing from a lot of the parents is frustration over the fact that some of them feel that this wasn't anticipated. It's been 2.5 months since schools closed. What was the county doing over the summer to get this system in place, and seems to be scrambling now to deal with this situation, even if the percentage is as low as Dr. Gale says it is? Secondly, Dr. Stoddard just mentioned that Montgomery County officials are having discussions with other counties. I'm curious as to your viewpoint on what the state's role should be in this right now. Obviously, the governor says he wanted to defer to local jurisdictions, but if we are seeing an increase because of this Delta variant, does there need to be a stronger input from the state superintendent or other means to come up with a statewide policy on this?
It's an interesting question. I would have preferred a better statewide policy. I mean, from my personal perspective, this is me. The school system was limited. They had a plan. I mean, if you look at what they sent out to parents, their plan was they were going to do pool testing. There's obviously a value of doing pool testing. And it may have worked, but I think what we're seeing is we need to be able to make rapid decisions. And it's not it's a limited number of cases, but it's actually would be useful to have that. And the state's insistence that the only way you get access to their tests is if you have an opt-in system limits this. Last week, for example, the school system has a plan, but they're not actually implementing the plan to this week. They didn't start asking parents to opt into the plan until the 27th of August. So I have no idea how many people have actually opted in so far, but they couldn't have even implemented their pool testing plan last week, let alone a point of the health room testing last week. And if they are going to test everybody who comes down to the health room, which I think they should do, then you need an opt-out system, not an opt-in system, because we will be waiting and you'll get a symptomatic child and you'll send the symptomatic child home because they've got symptoms, not knowing whether they're sniffle symptoms or whether they're COVID symptoms. And you may well wind up sending home people who are considered close contacts. Whereas if we had the tests in the health room, we would be able to deal with that. But that would mean the state would have to say, yes, you can get access to tests and you can do this in the health room. And so the school system opted for the system that fit the state guidelines. That's why I think we need to revisit this. And, one of the things that we've pointed out is that if we need to buy tests directly to bypass the state guidelines, we can do that. And then the school system to go to an opt-out test system. But the school system has to make that decision. I can't make the decision for the school system. So, I've seen what they sent out to parents, and they're very clear about what their testing plan was going to be. It is their testing plan. But I think all of us are looking at what happened and thinking like, this needs to be revised. At least I think it needs to be revised. And if the state had focused on this from the perspective of how do I get the maximum number of tests and the greatest amount of certainty, they would have told the school systems to put in place a point of the health room testing system and that to use an opt-out system, which would have maximized the effectiveness of the program. That is not the state guidance, and I wish it were.
Thank you. Next set of questions, Jordan Mincy, my MCM. Good afternoon, Jordan.
Good afternoon, Lorna, and thank you so much again for hosting this, everyone. County Executive Marc Elrich, you mentioned a rally that's coming up for refugees from Afghanistan. So I just wanted to know how many refugees are expected in Montgomery County, and what are the plans? Can you elaborate maybe on the plans to accommodate them?
Well, we're going to, our role in this is to help provide housing support, which means trying to find housing, which as we know is a challenging thing here. It isn't going to be changed, particularly affordable housing. That's not going to change overnight. But we're going to try to get people into housing because it's important, and they're going to obviously need social supports. They're going to need access to medical care. They're going to need support in order to get food, and hopefully the federal government will send along appropriate amounts of money to help us pay for this. Something that often has been sorely missing in policies the federal government has had in the past. I don't know the exact numbers. I think that's an evolving process, but the federal government works with the state, and then we get an allocation of refugees accordingly to help the state meet its goals.
Got it. Thank you very much.
I can add a little bit there more to that. So I've been privy to some of these meetings that the Department of Health and Human Services has been having. And one of the big things that we are doing is coordinating with our nonprofits like the International Rescue Committee, as well as some of our local nonprofits who do placement of persons, whether they're repatriation of those with connections to the area or new refugees. We have received some Afghan refugees. I think the last number I had was north of 40, and they have been placed as family units. I don't have the final numbers. We could probably get those updated for you. They began arriving actually before July, and we've been working with them to get them placed and get them supported. But obviously, as we go forward, we're obviously working with the Maryland Office of Refugees and Asylee, MORA, in their referral process to make sure that we can, support any additional refugees that are identified and need to be placed in Montgomery County. Similar efforts are in play, are ongoing in other parts of our parts of the region, and we are collaborating across regional borders with Prince George's County, the district, in Northern Virginia on these issues as well. But obviously, the point that we're trying to do now is really coordinating the internal resource support network between our nonprofits and government to make sure that as additional refugees come in, we can get them a full spectrum of services from healthcare to housing resources and beyond to allow them to be settled. One of the big challenges that are faced by refugees is that often with housing, there's a requirement that you have a established credit. And obviously they will not have established credit in the United States. And so obviously some of those options are very challenging for them. And that's really the role of the county and the nonprofits to try and help those individuals get up on their feet, establish good credit history, things like that, so they can proceed, with a new life here.
Thank you, Dr. Stoddard. Thank you, Jordan. Caitlin Peets, Bethesda Beat. Good afternoon, Caitlin.
Hi, thank you. I have a couple of questions. I just want to run through them one at a time. Dr. Gales, first a clarification for my help. When you're acknowledging that there's an area where the MCPS guidance kind of deviates from the MSD guidance, you're just for clarity, you're pointing to the point that says the close contacts of students with symptoms, but no negative tests or alternate diagnosis only need to quarantine if the symptomatic student had a known exposure to COVID-19. Is that correct? Am I understanding?
So the donut, if you will, in that is the state doesn't actually opine on the need for others to quarantine outside of household contacts. They recommend that household contacts do not attend work or school in that setting. And our approach is that, yes, we follow that, but we've also asked students pending the results who have been exposed to that individual to also quarantine until the result comes back one way or the other.
Okay, thank you. Okay, and then another question for you. It's my understanding that the updated MCPS quarantine guidelines originated from a conversation between yourself, Department of Health staff, and MCPS officials, rather than from a written transmittal or explanation. Did you or the Department of Health provide your recommendations for those updates in writing prior to, say, yesterday?
So the guidance that we've provided to MCPS is the culmination of sharing the state guidelines, again, that I referenced, that we are overwhelmingly following very closely with that one exception, as well as, meetings in terms of conversations with their senior staff and so forth. I confess, I don't recall exactly, in terms of written transmission, but the policy for disease control and contact tracing is the policy of HHS. And so we treat outbreaks in schools like we treat outbreaks in other areas in terms of providing guidance. And again, that guidance has been consistent and followed through the pandemic. If you recall, we went through this when a number of our non-public schools opened up last fall, where there were some issues, where there was some pushback from some in the community that felt that our decisions and guidance that we provided to leadership in those respective areas was too restrictive in terms of the students identified as close contacts. So this is not anything new. Again, we experienced this before, but the guidance that we have provided is consistent with what we have provided throughout the pandemic.
And I've heard that either yesterday or maybe this morning that the written version of this has since been provided. Is that correct?
Again, I'm not sure what your question is, other than to say that our guidance hasn't changed. And in terms of, I think there was an attempt to clarify, because, for example, as best as I can go through and discern what caused some confusion this weekend is that folks were fixated and under the belief that we solely only look at one symptom. And if we say Caitlin has a headache, then everybody in Caitlin's stratosphere are sent home in quarantine. And the clarification is, yes, based upon the guidelines, we do look at certain symptoms that are concerning. And if you think back to the fall, again, throughout the pandemic, we did distinguish symptoms that were suspicious for COVID-like illnesses that cause an extra index of concern. The clarification piece is just to make sure and emphasize to folks, particularly parents at home, is that it is not only looked at in terms of a symptom, it's also looked at in the larger picture. Again, if we can find a diagnosis or any type of medical history or other incident that can explain those symptoms, that alleviates our concern for that being a COVID case, that is extremely helpful too. So I say all that to say that it is an assessment that involves getting a broader picture before that advice is that particular advice is given or provided. And so in terms of what may have been submitted in writing overnight, that was information to clarify that, to make sure that parents at home understood the full spectrum of the process that we undertake in terms of contact tracing and providing those recommendations to the school system.
Okay, last question. You talked a little bit about providing clarification for parents and families and community members, but I just want to be clear here. Did MCPS correctly interpret what you recommended as updated quarantine guidelines? Were there any points from which MCPS deviates from what you would recommend?
So again, what MCPS put out was language that reflected the guidelines from the state in terms of looking at particular symptoms. And again, if we, since I'm not tech savvy, I would again reference you to the state guidelines that talks about that decision aid that looks at those symptoms at the top of the page. It says any one of these symptoms related to that. And so I think MCPS reported, and that was accurate to that. But we did, want to make sure that the depiction of that fully covered the full spectrum of how we look at those symptoms, again, in the context of a deeper investigation to differentiate as best as we can symptoms that are concerning for COVID or symptoms that can be explained by some other potential illness or exposure that would not require any close contacts to quarantine.
All right, you good, Caitlin?
Yeah, thank you.
Thank you. Tim Carney, Washington Examiner. Good afternoon, Tim.
Thank you. I'm on my screen.
Your audio is breaking, Tim.
Can you hear me?
Okay, try again.
Yes, Dr. Gales, congratulations. And to go back to an oldie but goodie, you had referenced last summer. And when I had asked you earlier this year about your comment that showed up in an email, the privileged classes have shown their butts in the effort of the non-public schools to resist your school closures. You deferred it on the fact that you hadn't looked at the context. I since emailed it to you, and that there's an ongoing lawsuit. That lawsuit has been ruled moot. So can you please comment? What were you trying to say when you said the privileged classes of Montgomery County have shown their behinds?
Tim, thank you for your question, and thank you for the congratulations on my next chapter. I don't have any further comment on the question that you raised. Thank you.
All right. So to follow up on Caitlin's questions on the quarantine, what very clearly came through from parents who forwarded me the emails I got from the school was that a single symptom was a automatic you get sent home. What you've been saying today suggests that that is in fact inaccurate. So it seems that schools have misinterpreted the guidance. Well, let me just say this. Can you say very clearly for us to tell to the school leaders, is a single symptom of coronavirus by a student an automatic trigger that student needs to get sent home and their close contacts have to quarantine as well?
Well, thank you again, Tim, for your next question. And to reiterate what was laid out in the earlier parts of the press briefing is that, first of all, the guidance that we are following and providing to our school system, again, both public and non-public schools, is consistent with the guidance that has been laid out by the State Department of Education and the State Department of Health. And so I would reference you again to the decision aid that lays out the symptoms of concern within that context. And it says any one of those symptoms or COVID-like symptoms should trigger utilizing that decision aid that is available. And consistent with, again, my comments earlier, as well as the approach that we've taken through the pandemic, is that the school health staff, working with the disease control team, do provide guidance, again, doing an assessment. So it is seeing those symptoms and say, okay, this is raising an alarm. Let's do some more due diligence in terms of finding out, again, if there is an alternative diagnosis that can explain those symptoms. If there is any, concern about a known exposure, is this, again, to get deeper context before making that ultimate decision to say everybody has to quarantine who's a close contact based upon that symptom. And so we have been working to ensure that all of our staff are, again, doing that due diligence to make sure that when they make that clinical determination and saying, okay, this student is concerned, their symptoms are concerning, they need to go home, and to make sure that they don't have, again, any other alternative diagnosis or any other alternative history that can explain away those symptoms that would then not require any of those close contacts to quarantine while that student gets tested. And I think this also underscores, to pivot a little bit, this also underscores for parents at home, if your children are not well and they are demonstrating symptoms and exhibiting symptoms, we do ask that you keep them home. Because one, we don't know what all those symptoms are. If a child is not well, we want them to get the help that they need and seek the medical attention that they need so that they can recover and be well, and then potentially not expose others to those symptoms within the classroom space.
So I just want to try to see if you could give if I understand an example of an alternative diagnosis. A kid, it says she feels totally exhausted. Exhaustion is one of these symptoms. But then they say, well, it's because I ran a mile in gym class. Would that be enough possibly for a school health official to say, okay, this is not COVID, go back to your class?
Well, again, it's a full picture. So we can pick out different things and say, well, what about this? What about that? But it's a full picture and every situation is different. But, the example you gave, if there is a reasonable explanation for symptoms, then that, again, would reduce or minimize the risk of suspicion. So for example, if you have someone who, I think there was reported a student who may have vomited after riding the bus who has a significant history of motion sickness, or an individual who, let's just say, I don't know what you had for dinner last night, but let's just say it was something that didn't agree with your system or it was some bad meat or something like that. And someone was exhibiting some gastrointestinal related symptoms. And as part of their history, you could track it back to something that could explain that, again, that's not COVID related. Again, those are broad categories, but those are the types of questions that staff ask in order to get more information, again, to differentiate between those symptoms, again, putting them in a space of COVID concern versus something else that could be explained. And by the way, I hope you had something good for dinner last night, and I'm not wishing any GI symptoms on you later today.
Thank you.
You. My wife's an excellent cook.
Thank you, Tim. I do not see any more requests for questions from members of the media. Reporters, going once, going twice. I think we're done for today. Farewell to you and the best, Dr. Gales. I'll miss you. We'll miss you. And thank you, all of you, for joining us today. We'll see you soon. Stay safe.
Thank you all.